On the first day of Christmas, my ER gave to me a CHF exacerbation. Let's talk about what do we do when a patient comes in a CHF exacerbation. Well, first of all, we have to recognize it. A lot of times these patients come in with sky high blood pressures. I'm talking 230s over 120s. However, sometimes there might be a case that's going to bamboozle you because they're going to present with hypotension instead of that normal hypertension that we're used to seeing in these patients, because sometimes it is a localized infarction. The heart is failing because there is a little piece of it that has infarcted. It's being starved of oxygen. So it's really important that we grab a 12-lead ECG on these patients to be able to determine if there's an infarction. Now, if this is just a standard CHF exacerbation, the problem that's going on with the heart is we're going to have that left ventricular hypertrophy. That left ventricle is big and beefy and overformed because it's been working so hard to push against that really high afterload for many, many years, usually in these patients that have a long history of hypertension. So that's another thing you're going to see on that ECG is you're going to see that really tall amplitude in leads V5 and V6, because those are the two electrodes that are really close to the left ventricle, and they're looking right there close at the left ventricle. So you're going to see the big amplitude in those two leads. Additionally, you're going to see left axis deviation because axis deviates toward hypertrophy. Okay, so you've recognized it in your patient. Now what do we do about it? Well, we can reduce that afterload. That afterload is that really tight systemic vascular resistance, and we can bring that down with nitro. Now, there for a while, we thought it was pretty cool to give these patients like mega huge doses of nitro, but the emerging literature says that we can just use kind of our standard infusion rates of nitro, and we will be able to achieve the desired effect on these patients. So drop that afterload so that the left ventricle isn't trying to push so hard against that afterload. Additionally, these patients present with that dyspnea, that they are working so hard to breathe because they're so air hungry. So let's give them that air and let's give them some pressure to overcome that flash pulmonary edema that they have developed. And placing these patients on CPAP or BiPAP is going to do a couple of things. Number one, it's going to reduce the pressure gradient that we're seeing really high pressure inside the pulmonary vasculature and really low pressure there inside the alveoli. So we increase the pressure in the alveoli. And also it's going to stretch out those alveoli and increase the surface area so that we have more surface area, more real estate to be able to diffuse those gas molecules across. Additionally, we're going to crank up their FiO2 to be able to concentrate a whole bunch of oxygen molecules in that alveoli so that it can diffuse across the alveolar capillary membrane. So there you have it, a helpful hint on how to take care of and recognize a CHF exacerbation.